Good day, fellow instructors. Good day, ROTC officers and cadets. We will continue with our discussion on first aid. We have discussed last time about BLS CPR, which is also an important skill for first aid. So today we will be discussing more of first aid, and of course we will continue with the skills on splinting, bandaging, and lifts and carries. Please allow me to remove my mask. Anyway, I'm just here alone with some officers outside. So, this is just to remind everyone that in this time of crisis that we have, in this time of pandemic, you have to wear your mask all the time, always. Okay? So that is not only to protect others, but also to protect yourself. So, last time we have discussed, as I said, we have discussed about BLS and CPR, and sorry that I missed to discuss doing Heimlich maneuver or removing the foreign body substance from the baby's throat. So what we have discussed last time is removing the foreign body substance from the throat of an adult, okay, to how we are going to intervene the choking in adult. So how about for the baby? How are you going to remove that substance that is stuck on the baby's throat? Okay, so what you have to do is to do the 5 chest thrust and the 5 back blows. Okay, so when you do back blows, it should be in the middle of the back, between the scapulae of the baby. So 5 back blows, okay, whichever you are comfortable with, left or right. Okay, you just support the chin of the baby with your hand. Anyway, the baby is so small, so you can, if you're not comfortable with doing like that, then you can sit down and look. You can lower the head of the baby, and you can support with your lap. So you do the 5 back blows, 1, 2, 3, 4, 5, and then you turn the baby into supine position, and you do the chest thrust. Okay, 1, 2, 3, 4, 5. So 5 back blows and 5 chest thrust. Again, if wala pa gyapon ni gawas ang foreign body, di pa niyo makita. So you do the 5 back blows, 1, 2, 3, 4, 5. Okay, paana siya? Dili siya kalit anak raha, but going there. So lower gamay ang iyahang face, iyahang chin, lower gamay diha. So you support. Dili nimo siya i-choke. Don't choke the baby, but your hand is on the chin of the baby. Okay, so you do the 5 back blows, 1, 2, 3, 4, 5, and then turn the baby into supine, and you do the 5 chest thrust, 1, 2, 3, 4, 5. At the same time, you check on the foreign substance, kanang naka-choke niya. So if the baby will go into an arrest, wala yung hangin, then you may give ventilation, mouth-to-mouth ventilation, or else you can put the baby on a firm, flat surface, like the table, and you do the CPR, the chest compressions. So when you do the chest compressions, it will be between the 2 nipples, okay, in the middle of the chest, and you do the compression using your 2 fingers. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That will be up to 30. And then you do the head, tail, chin lift, and you give that to ventilation, to mouth-to-mouth resuscitation. Okay, inserting the baby's nose and mouth with your mouth, and then you give that pump, and then like that. Okay, of course, you will not be using your mask, or else how can you give proper ventilation to the baby? But as I've said last time, there is now an option, especially for adult CPR. You may just give the chest compressions or hands-only CPR without the mouth-to-mouth ventilation. Okay? So I hope that will be clear. And then, by the way, how about if nag-choke ka? Or how about if ikaw ang natukanan? Nobody is inside the room. Ikaw na usang kakaon. Tukan ka. You try to cough it out, but it seems that it's really stuck inside. So That's why don't try to do the blind sweep, or else you might just be pushing that object into pasunod pa yun. And you know what? Especially kaniha, sa baby or sa mga batang gagmay, tendency nila when they're able to swallow something, tendency nila is they will jump. And the moment they're going to jump, the more that the foreign object is pushed into the throat. So that is very dangerous already. It may be difficult. So there were kids who died because they were not given the first aid. And tarantar, ano yun na siya? Panic mo usahay. So as first aider, don't panic. Be calm. Okay? And prevention is better than cure. Actually, first aid is, we always think about prevention. Because prevention is always better than cure. So, going back, if ikaw na natukan, so what are you going to do? Get a chair. You can get a chair, and then it seems that you can do, it seems that you will be doing the Heimlich as you do it this way. No? Inaananin mo ang chair. Motion is like this. No? Pasulod, going up. Pasulod, going up. Okay? So, you can use that chair as if you are going to do your own Heimlich. No? Inaananin mo. Doon, pasulod, and paano. As what we had demonstrated last time, when you do Heimlich maneuver, it is between your umbilicus or your navel or kanang imong pusod and your xiphoid process, kuto-kuto. Between that, you make a fist, and a motion is like this. Like this. Okay, ana siya. Ana. So, same, if ikaw matukan alone, you do it the same. Okay? Para nga, magawas ng imo. But you try to cough up. Cough it up. Okay? Even sa adult, choking, you encourage that person to cough up, cough out. Okay? So, to move on, we will be discussing more on first aid. At this time, actually, first aid sa nursing, no, or sa medical field, it would take about pila ka weeks na session. However, in our case, we just shortened it. So please bear with me. We will just discuss the salient points and those that are applicable in the field or in the war or in the combat and in cases of calamities or disasters. So what are the first aid that are usually being used, no? So that's what we are going to discuss, no? Especially when we will be having our OTC training in the field, then this might be applied also. Okay, so first and foremost, we will be discussing about heat emergencies. So what are these heat emergencies? The picture speaks for itself. Okay, so there are 3 types of heat emergencies, and these are heat exhaustion, heat stroke, and heat cramps. Okay, what are the differences of the 3? So heat exhaustion is less dangerous than heat stroke. Heat stroke is a medical emergency. Okay, heat stroke is a medical emergency. So heat exhaustion is caused by fluid loss, which in turn causes blood flow to decrease in vital organs, resulting in a form of shock. Okay, nga naman, kung heat exhaustion, syempre, bulag ka sa init, no? And then you become dehydrated. With that, you will have hypovolemic shock. You can have hypovolemic shock because of dehydration, or you may also have that heat exhaustion. Okay? So, this is a response, no, to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for the loss of fluids. Because, of course, when you are there under the heat of the sun, you will be losing fluids, diba? Mo evaporate, kusog kayo mo evaporate, especially if you are doing physical activities. No? So, some signs and symptoms of this are there is history of physical activity, exertion. Okay? Then pallor, pale siya, luspan, no, bugnaw iyang cold clammy skin, bugnaw pero hagkot iyang panit. Fast, weak pulse, fast but weak, no, thready, weak and thready. So, nauseated, murag kasukaon, no, and then buyod or lipong. And of course, lapse of consciousness. The person can go into and can become unconscious, no, makuyapan. So, how are we going to manage this? Let the victim rest. Okay, with feet elevated. Why? Why are we going to elevate the foot part? So the foot part will be elevated at least 1 foot above the heart. So kung gahigda siya, elevate, no? Pwede na siya. Higda siya diha, ipatong sa silya. Or kung wala silya, then look for something na mapatungan mo sa iyang sa iyang feet. Or you ask somebody to lift the feet of the victim. So let the victim, kung wala siya na kuyapan, of course you can ask the victim to sip beverages, especially kato na ay electrolyte. But mind you ha, don't let the victim kato mga like mga sa tawag na katong extra jaws. Why? Because if the victim has heart problems, then it may lead to some complications. Okay, we have an athlete here in Siliman before who succumbed into cardiac arrest. Okay, lagi, bagay kay batan-on, no? Ni-survive siya, but sad to say, affected with yung brain kay for how many minutes na wala siya yung oxygen, no? So it's so dangerous. As I've said, when we discussed about BLS CPR, 10 minutes without oxygen, there might be irreversible brain damage or brain death. So that's why, no, kuanto siya, inom siya Gatorade. Unyag, sugundahan pag yun yung extra juice. So, baling kusukas, ipa kayo. So, what happened? He went into cardiac arrest. Okay? Delikado kayo. So, monitor. So, pwede na, katulang mga with electrolyte drinks, but be careful kung ano. No, sip, that's why sip only. Then, monitor the victim of signs of shock. So, what are the signs of shock? Loss of consciousness or kanang mag-confuse na siya, and then kanang iyang mata musulirap na, no, and then pallor, no, or if dili siya kuan dizzy siya, and then confused, no, murag libog asan daron ana ba, murag delirium, no. So those are the signs and symptoms of going into shock, no, and then cold clammy skin, ipaningot og bugnaw, no. Okay, so if na-loss your consciousness, of course, you have to, what will you do? Loosen everything. Na kanang like, for example, belt. Katong all constrictive clothing in the body of the patient must be loosened. For example, yung shoes, ang kanang shoelace, yung belt, yung bra for in the case of women, no? So loosen those constricting clothing. Okay? And then what else? What else are you going to do for heat exhaustion? Okay? So I think more na siya, no? More basic kaayo. And then what is heat cramp? The same. Ang imuhang kuan is na siya exposure to the heat of the sun. So unsa man ang iyang sign and symptoms gyud? Number one is of course na siya heat cramps. That's why kung sige kag bulad skinhead, no nya, wala pa gyud kay like itong mga malnourished, so they lack the necessary electrolytes like potassium. No, that's why mga athletes, mga runners, when we have marathon, aside sa water nga gibutang sa first aid station or water station, naano gyud butang banana and chips. Why is that so? Banana, it contains potassium, and chips, it contains salt. No, aside instead na salt ng ilang itimo, paano lang chips na lang kay salty man po. So at least the athlete can have salt and can have sodium and potassium, have electrolyte balance. Plus, of course, they have to hydrate. More na siya. As I've said, first aid is, I mean, in first aid, prevention is better than cure. So, if you are going to the field, for example, kung natin training, ROTC training, then the night before, you must have enough rest, no, 8 hours of sleep. Dili na maglaag ka ng Friday night, kay Saturday ato ang training. No, even at you're in the comfort of your homes, even then, because you have to wake up early, like 6 o'clock, check na attendance. So you must have enough rest so that you won't be oversleeping. No, so with heat cramps, of course, there are signs and symptoms of cramps. Asa man usual ang cramps? It could be sa calf, no, bagtak, or any other muscle group. So pwede po siya sa paa, or sa bukton, or sa abdominal. And or else pwede po siya sa back. No, this will be areas where cramps can be manifested. Okay, so how are you going to manage that? Again, bring the victim to the cooler place. No, take the victim away from the heat of the sun, and of course you can rehydrate the victim. No, ask him to drink water and katong mga electrolyte containing beverages, sips of those. Or clear juice. And then you can have the gentle range of motion. Gentle but firm range of motion and gentle massage. So kung ang iyang cramp is naa sa bagtak, okay, you let the victim do the dorsiflexion. So you have to counteract the cramps. Kung asa ang cramp, like kung dinhi, stretch na siya. So dapat stretch. And then the massage would be for long firm strokes. Not the katong ana-ana, kay the more siya mo cramps. No? So long firm strokes, okay, or else range of motion. Okay, and you'll ask the victim to like eat banana, not take chips. So again, electrolyte, sodium and potassium. Okay, so muna siya sa cramps or sa heat stroke. How about heat stroke? This is a medical emergency, life-threatening condition, wherein the body temperature can reach up to 104 degrees Fahrenheit or 40 degrees centigrade. So very high temperature, init kayo siya. No? So that is one of the manifestation or symptom yun of this stroke. So, and then, kuan ko ang ihang sweating, no? Kanang naay problem sa iyang sweating, mala, dry. So, kaganiha, sa heat exhaustion, singot kay basa hagpot. This time, ang heat stroke could be dry and then pula kayo siya. No? So, the victim can also, this can lead actually to coma. No? Can lead to coma and can lead to brain damage. Okay? Especially, and organ failure. And that is actually the reason why this is life-threatening. It can lead to death and heat stroke. So with the victim na heat stroke, okay, you really have to call for an ambulance. You have to bring the victim as much as possible fast to the hospital. But of course, you do the first aid en route. So how is that? What would be your first aid again? You prevent shock. Since init mo kay shock, you can cover the victim with wet cold blanket. Okay, and then elevate the foot part 1 foot away from the heart, above the heart. Okay, and then you may you may not allow the victim to drink the beverages, especially kung alcohol ang beverage or caffeinated. Okay, but you can even shower the victim, no? And you can give CPR in case mag-cardiac arrest siya. Okay? So, as I've said a while ago, ang symptoms ato is dry, flushed skin, reddened, no, pula, and then sometimes napod siya, most of the time, no, confusion, delirium, or loss of consciousness, okay, muscle weakness, then tachycardia, or kanamuragin siya galumba, galumba siya dugan, racing heart, no? Ang pulse niya is strong pulse, okay, and fast, strong and fast. Ganiha sa exhaustion, weak and fast. This time strong and fast. Okay? Rapid breathing, paspas kang ginhawa. So, moto, no? Prevent the victim to go into shock. Okay? So, cool the victim, bring the victim to a cooler place, and you can be ready. You must be ready to give first aid for shock. Okay, so let's move on. We have been discussing about shock. So let's discuss about shock. So there are different kinds of shock, no? As I mentioned a while ago, hypovolemic shock. Then we have cardiogenic shock. The cardiogenic shock is, ang hypovolemic shock, by the way, is katong lack of fluids in the circulation. So either because of dehydration or because of bleeding. So kamay na lang ang imong fluid. So with bleeding, you will be, muna siya usual cause of death sa katong mga gunshot wounds or katong mga nasamadan, amputation. Okay? So, hypovolemic shock. Then cardiogenic shock, cardiac in origin, na problem sa heart. The heart is not beating well, so cardiogenic shock. And then we have the anaphylactic shock, katong severe allergy. No? Mulit into anaphylactic shock. And we also have the neurogenic shock. Too much pain can lead to shock actually. Neurogenic. Yung origin is kanang sa nerves, no? Or spinal cord injury, so you have neurogenic shock. And lastly, we also have the it's from my mind, no? So the other one is septic shock. What's septic shock? Because of the severe infection. septicemia, the infection that is now all over the body, in the blood, ang bacteria, and it even reaches the brain. So you have septic shock. Okay, so there are different kinds of shock. Dili siya shock, hala, na-shock. Oh no, it's not like that. But that could be a symptom of neurogenic shock. Kana bang startled ka, you know, it can lead to neurogenic shock. Okay, so shock must be treated in all accident cases also. No? So shock affects all major functions of the body. And I have mentioned kanina on sa mga reasons why the person can go into shock. And the signs and symptoms again could be dizziness, lightheadedness, change in sensorium, or change in kanang iyahang like ma-confused siya, or kanang naay so they change sa iyahang consciousness, no? Anxiety, confusion, agitation, kasukaon, how kaayo, mala ang tutunan, change in responsiveness, fast, weak pulse, and patient can go into unconsciousness. So what would be your first aid for this? Check the airway, breathing, circulation, the ABC, and care for life-threatening injuries. So what are the life-threatening injuries? Bleeding, for example, that is life-threatening. Huwag na magdugo. Kung allergy, then you give anti-allergies. Or kung nasa asthma, nag-asthma na siya sugod, no? You can give iyahang inhaler. Kung cardiogenic ang origin, then you can give CPR. Okay? So, of course, with shock, you really have to call for help. Okay? And let the victim lie on his or her back and raise the victim's foot at least 1 foot above the heart and loosen any tight clothing, any constricting clothing, and try to maintain normal body temperature. Okay, you can see there the victim is covered with blanket. Okay. Then for anaphylaxis, again as I've said a while ago, anaphylaxis could be a severe form of allergy. Okay, severe allergic reaction, and this can also be a life-threatening condition. Okay, why? With anaphylactic condition, the airway could be constricting, and so the air cannot pass through the lungs anymore. Okay, so there are common causes of anaphylactic shock, like anaphylaxis. It could be due to medications or food, allergy to food, and it could also be due to insect stings and bites of animals or bites of insects. So when you see that there is difficulty in breathing or there is wheezing, what is wheezing? Kana ba murag naay piso sa tugan, like that could be wheezing, no? Naay tingog, mong shaok ang dugan pag ginhawa. No, complaints of tightness in the throat or chest tightness, swelling of the face, murag ni swell na siya kay dili sa ginhawa. No, then puffy ang iyang eyes, no, kanang murag niburot na iyang kahala ng eye bags dili siya. But it could be a sign of allergy already. Anxiety, agitation, kasukaon, nausea and vomiting, and so pwede siya musuka. Change in level of consciousness. So, what siya dizzy, kanang murag katulugon siya, hard to wake up, or confused, or nag-delirium na siya. So this could be changes in the sensorium of the victim. No, change in responsiveness, dugay kayo kanang gapiyong na siya niya, uy, mata, dili kayo mo tuwag. No? It's hard to wake the victim up. Okay? So what will you do first? First and foremost, again, is call for help. Okay? Call for an ambulance. And then you can give basic life support or CPR as needed. Help the victim use his or emergency medication. So kung asthmatic siya, then you can ask the victim to do kanang, kung na-nebulizer, nebulize. Kung wala inhaler, na siya inhaler, let him inhale the kanang iyang inhaler. Okay? Or kung allergic din siya, na siya history of allergy, then most probably naayon na siya anti-allergy medication like Benadryl, for example, or antihistamine. So let the victim take that. Okay? And help the victim to have easiest breathing. So comfortable position. So what could that be? It could be tripod position, or basta ka nang elevate ang head part, no? Dayon, foot part, elevate na po ang foot part para prevent shock, no? So you have to stay with the victim and offer reassurance or comfort because, as I said last time, your mere presence could be very comforting to the victim, and it could allay his or her anxiety. So put the unresponsive victim in recovery position. Okay, now let's go to asthma. Asthma, this condition could be due to an allergen. No? Kaya ba? Like for example, not siya history of asthma, but then naka-inhale siya of smoke, or naay earring sa palibot niya, naka-inhale siya sa balahibo. So that could be one of the reasons why there could be an asthma attack, or due to physical exertion, like asthmatic siya niya, gikapoy siya, bakit ipadagan siya, niya gihangak, na-treat ka asthma. So what are the signs and symptoms again? Wheezing, difficulty in breathing and speaking. Okay, dry persistent cough, sigmurag gihotoy, no? And then fear and anxiety, mo change ang tiyang color sa skin, like mo gray to blue, okay, or mga luspad, or mga pula, no? Change the level of responsiveness or change the level of consciousness. So what should you do? Okay, let the victim puff sa iyahang inhaler, okay? And then you call for help also, and it may worsen, no? Help the victim use his or her medication. Let the victim rest, sit in position of easiest breathing. So, like, kuan siya, kanang handag, no? Then, the victim may use the inhaler 5 to 10 minutes if needed. So, there could also be diabetic emergencies, no? Okay. In diabetic emergencies, like hypoglycemia or ni-surge yung kuan, yung insulin, yung sugar. Then, for diabetic, you ask the victim if nagdala siya siyang medication. So, if there is a surge in sugar, then you ask the victim to inject yung insulin na fast-acting. Pero kung in the case of hypoglycemia, like, ang diabetic ng good, dili pud angay magutman. So, kung nag-hypoglycemia siya, like symptoms of hypoglycemia could be cold, clammy skin, and then ng luspad, and then brag mo change niyang consciousness, brag siya, mailan na siya kayo, siya, toy akong piyan, gutom kaayo. So, you ask the victim to sip, okay, sugar drinks, no, like juice, no, or else you ask the victim to bite ka ng candies or kanang to eat kanang sugar, no. Basta kailangan yung siya snacks. Again, as I've said, sa first aid, prevention is better than cure. Kung kabalo ka mag-diabetic ka, then you must always take your medications on time. And you must have your in-between meals, in-between snacks. Okay, prevention is better than cure. Kung asthmatic ka, you know that you have asthma, know the triggers of asthma. Maorgan na siya. Okay? So, fever, it's easy. Most of us have tried having fever, diba? So what did you do when you have fever? Of course, you have to, sa first aid po diyan, no? Paano gina siya? First aid is actually common sense. Common sense, sentido common. Kung hinantan, kung sa may buhaton, we're ang fever. Prevent convulsion. Because kung mag-convulsion siya, delikado man affected ang brain. So, you can give cold drinks, you can kanang i-wipe siya o cold, kanang tepid water. What is tepid water? Nanagay makadong mga tepid sponge bath. No? So, saan siya? Rapuhan o kanang tubig na gikan na strip or gikan sa bomba. Or, pwede ka ng tubig na nai-ice gamay. Pero mind you, be careful kasi mag-shields po siya. So that's why kung sa hospital, mag-tepid sponge bath, gatrapo, naapoy, inilit tubig sa lapalapa. No? Kanang dili pag init tayo, kaya mapasoon niya. No? Muna siya sa fever. Ask the victim to, you may, kung 38 na kapin, then we have over-the-counter medications like paracetamol. Okay, pwede na siya mag-take. So ang paracetamol po, every 4 hours ang interval. Every 4 hours ang interval. So, ang fever galing na mo more than 3 days, there must be an infection here. So, bring the victim, bring the child or the person na having fever to the doctor for consultation. Kaya basig need din siya o antibiotics or other medications. Kaya kung saan hinunan sa fever. Fever is actually a reaction of the body against a condition, like for example, an infection. Okay? So, kung fever na wala din ka, maubos na siya kayo tumar para sa tamol, balik na po, balik na fever, especially kung high fever. Okay, high fever could also be due to viral fever, no? And then, like for example, sa dengue is a viral. Okay, so dili siya madala og antibiotics. But with viral disease, self-limiting na siya. Unsa may self-limiting? Maayo na siya iyaha. Maayo siya on its own course. Depende sa imong resistance. So that's why, kuan kanang boost your immune system all the time. Okay, enough rest, healthy lifestyle. Okay, eat more fruits and vegetables so that you can have kanang minerals and vitamins, and better kung well-balanced nutritious diet din ka. And of course, you also need to have exercise. Especially with our case karon in the pandemic, and we are always facing our laptops, our computers, sedentary lifestyle na ta. You have, na siya yung rule ng 2020, no? 20 minutes ka mo matindog, anak, no? And then look at the surroundings, and refresh your eyes through looking at the green surroundings, no? And you have to move, you have to do exercise. Kaya kanang prolonged sitting can lead to stroke and even cardiac arrest. Why? Muklat yung blood na. Then the moment you stand up, katong clot will travel na, and it can lodge to the brain, so it will lead to stroke. If it will lodge to the heart, it can lead to cardiac arrest. Okay. Headache, of course, again, natay mga over-the-counter drugs, over-the-counter medications. For abdominal pain, you also have to identify what could be the cause of the abdominal pain. It could be gas. No? Kanang usay po, kanang yung sige tagtabi, sige tagkatawa, but sige po kanang ingest o gas. No? So, bloat at ubiyan po, kwanta. Or else, it could be due to indigestion, or it could be due to bacterial infection. So, just bring the victim to the nearest hospital or nearest sa clinic for consultations. Because kung gasuka siya, of course, kung gasuka kalibang siya, your management would be to prevent dehydration. So, what would that be? You can, kung gasuka siya kalibang, it could be volume to volume fluid replacement. So, you ask the victim to drink Oresol, ORS, oral rehydration solution, to replenish the salts and the fluids that is being excreted through vomiting and through defecation, through kanang bowel movement. Lose bowel ka more than 3 times, no? So, kuan siya, inom siya og kanang ORS. Kung di gyud madala, pagtanan nimo nga hala, murag misugod na galong iyang mata, and then pag pinch nimo murag dugay kay mo return, especially pag press nimo sa iyang nail beds, murag dugay kay mo balik ang iyang color. No, so bring the victim na to the hospital, or especially kung child or elderly. Why? Dehydration could be very dangerous. No, dili na kung dehydrated na siya, especially kung child or elderly, lisod na pagitaw ng iyang ugat. And many people die of dehydration. Remember, dehydration, it could lead to hypovolemic shock. Okay, so vomiting and diarrhea, we have discussed that. Poisoning. With poisoning, this could be due to the food that is kanang daot, or it could be kanang overdosage sa medication, no, or because of injection of a venom, like for example kanang mga bee stings, or other insect bites, okay, or katong sa accidental, no, nga na-inject na inom sa bata ang katong unsa na daghan kayong history ana. No, na nainom sa bata ang katong silver cleaners amahan, kay ka-work sa kanang jewelry shop ang father niya, ang silver cleaner gibutang sa Sprite katong sundanan. So ang bata eventually kay makakita siya nga Sprite rin nun, ininom. So or kana atong mga medicines, no, napudoy isa ka bata nga namatay, na poison, no, because ang anti-arthritis medication sa father abi niya can be kauntanan. Una, delikado kaayo. So again, as I said, prevention is always better than cure. Okay? Before we do first aid, always prevent. So you can do mapping in your home. Unsay mga hazards, unsay mga risk factors of all this to prevent any untoward or kanang mga incidents, mga accidents. Okay? So, poisons can be ingested, inhaled, no? Like for example, carbon monoxide poisoning, naka sa enclosed space, kunya kuan kanang ang sakyanan, no? Under ba or wala under, depende na. No, absorb poisons like ang air, no? Nakakasa, like for example sa sulfuric vent. Okay, ma-inhale ka ng too much sulfur, or it could also seep through sa imuhang pores. Injected poisons like kana, no? Kita niyo, no? Cobra, poisonous kayo. So, what will you do with that? Okay, kung ingested siya, usually mag-burn ang imuhang knife. Kanang murag corrosive, no? Ingested poisons, corrosive kaayo kanang murag kuan imuhang tiyan, no? So, don't ask the victim to vomit. Or else, pag inom niya ato na anay kuan sama dito, pag-vomit na po nimo niya, nakuan na po. Okay, so lain ang pagsimog nimo niya, lain og baho ang iyahang ginhawa. Okay, the victim can also have nausea and vomiting and abdominal pain or diarrhea. Okay, so this could be signs of ingested poison. So there could be instances when vomiting should not be induced. No, as I said a while ago, no, if unresponsive ang victim, dili kung siya nagpasukan, or else it can lead to what? Suffocation or kanang choking, or it can lead to aspiration. So cannot maintain airway, no, may problem sa iyahang pagginhawa, or has ingested an acid or corrosive substance, dili na siya nimo ipasuka. Like for example, lye or petroleum products such as gasoline, dili na siya nimo pasukaon. Kay pag inom ato niya, there could be mga nangasama na dito, corrosive siya. Pagpabalik, pagpasukan nimo again na brand na adding insult to injury, no? Or else kung nasa mga medical condition like this can be complicated by vomiting. Like for example, nasa heart problem or seizure or pregnant siya, so this can complicate, no? Kung imong siya pasukan. With food poisoning, okay, you can see in your slides or in your sa soul, no, I have shared this PowerPoint. No, you have nausea and vomiting, stomach cramps, diarrhea, fever, mga sakit-sakit sa lawas, signs of shock, no? So dizziness, slurred speech. So what will you do with food poisoning? So you have to monitor and maintain airway and breathing. Call for medical help or bring the victim to the nearest hospital. Give the victim plenty of fluids para na iyahang iyahang makalibang po siya or mapagawas niya, ma-excrete niya ang food na mag-digest, makuan tayo, no? Mapagawas na. Support the person for if the person will vomit. So again, you can give you can replenish the fluids and electrolytes. Okay? So kung nasa skin contact with a poison, okay, so you have what you are going to do, or kanang inhaled poison, you have to bring the victim to a safer place. Take the victim away from the source of the poison. Like kung enclosed ang space, bring the victim to the open space. Or kung naa sa iyang skin ang poison, then you have to thoroughly wash with soap and water, no? Or with a dry cloth, let the poison from the skin, no? Then flood the area with copious daghan kaayong water. Continue until medical personnel arrive. Okay? And you have to continue to monitor the vital signs. Kung injected poison, like for example, katong napaakan or na-insect bites or sting or katong paan, you have to remove the stinger. Okay? And then, makita mo na, kay na-stinger or na-insect bites or na-pain and swelling, allergic reactions can happen, nausea and vomiting, there could be difficulty in breathing, okay? Or there could be bleeding, in the case nga kanang napaakan siya. Okay, na-eye bleeding, no? So, what will you do? Remove the stinger. Kung insect bite, wash the wound with soap, with water. Copious good, daghan good. Control bleeding. In the case of animal bites, apply cold pack. Cold pack niya kung i-apply. Ayaw pang butayo, mga ahos, mga unsa pa diha, no? Apply cold pack and then the water. Then keep the bitten part lower than the heart. Okay? Like sa snake bite, no? Lower yun na siya than the heart. Okay, call for help dayon or transport the victim right away. So key first aid principles in dealing with poison: protect yourself and the bystanders from the source of the poison. It's not anymore na kung napaakan o like for example napaakan o snake, imong supsupon. No, it's not anymore applicable, ha? Dili siya pwede. Okay, kung remember our mouth, not outside mouth, sores or sa pwede ang ato ang ngipon ay daot, then ikaw na po ang maka-ingest sa poison or sa venom. So, dili siya supsupon. Okay? Monitor and maintain the victim's airway and breathing. Seek for for appropriate medical help, monitor the victim's level of consciousness, support the victim if he or she vomits, treat the burns, okay, caused by corrosive poisons by flooding the affected area with running water. Try to identify the source of poison. Okay, ba ito may kanami ka, mapaakad ka, like for example, tilas, tilasan ka. You have to, like katong ID ba mo or kanang something na imong i-remove, no? I-ano imong ward off ang katong anak. Kanang sa kinaraan, anaon pero buhok, unya kanang buhok, nag-ano nimo siya na pud panan sa kanang iyang murag balahibo, no? Sa tilas, example, so imo na siya anaon. Dayon, you can apply katong kalaman, no? Sa katong mga tilasan, example. And naagyoy nag-anaphylactic shock anang tilas, actually. Nag-anaphylactic shock. Okay, so I guess kanang with snake and spider bites, okay, the same na kaniha ko na na-mention. What will you do sa first aid ana? Okay? Now with burns, there are three kinds of burns. Partial thickness or superficial burn. Okay, first degree burn or superficial burn, kanara like for example sunburn. Then you have your partial thickness or second degree burn, and you have the full thickness or the third degree burn. So kana third degree burn, ang iyang napil na gyud ang iyang sebaceous gland, no, katong fatty deposits. So with the third degree burn, dili na siya nimo pwedeng kanang bugasan gyud og tubig ha. Di ba sa first degree burn, you have to bring the victim away from the source of the burn. So kung nag-sunburn, ayaw na siya pakalibuas dito, init, under sa heat sa sun. So yun no? Kung sa first degree, pwede pa na siya nimo water yun, no? Yun Dayon, pwede pa siya nimo butangan o burn ointment. Pero sa second degree burn, okay, with the second degree burn, you have to pull the area surrounding, no, surrounding the burned part. With the third degree burn, no, ayaw na siya. Ang surrounding area na lang imong i-flush of water. And then, don't remove the clothing that is sticking on the burn. Or else, pag remove anak, it may lead to severe infection or it may lead to bleeding. Okay, tanawa, charred ang iyang skin with the third degree burn. Okay? So, do not overcool the victim. Do not apply water under pressure. Kaya, sukayo, no. Do not remove the burn clothing if it's sticking on the wound. Do not put cotton wool or any other fluffy material on the burn. Do not put any creams or ointments to the burn because this is needed to be removed in the hospital. Do not burst the blister, okay? Because it may lead to, it may increase the risk for infection. Okay, so soft tissue injuries, okay, you have there, dahil na siya kinds of wounds, no? Hematoma, contusion, okay? Closed wound. For closed wound, remember the first aid tip, ICES. The acronym ICES for the closed wound, like kanang black eye or kanang bunol, hematoma, ICES ra. Apply ice, compress, so elevate and do splinting. So your splints, okay, we will be discussing more about splints on yan, no? So you can use the ice cap. You will be putting ice inside. Okay, and you have to check if dili pa siya kanang agas. Then with this, okay na siya i-apply dayo. Diretso kay naman na siya yung cloth, no. But this one, the ice cap, ice pack by the way, you will put ice here inside, no. Napay na yung klase ani, napay usang pari-pari ani pero mas thicker. Pwede siya butangan katong usang klase nga pareha ang tsura, no, parehong forma, hot water bag. But this is an ice pack. So butangan mo ice until this level only. Okay, fill to this level only. Why? Because you are going to imo pa na siya isaradoon. Okay, anong sirado. Okay, and then imo siyang i-seal. Pag seal nimo, then you put this inside the cloth covering, like for example pillowcase or towel para nga dili kay siya bugnaw nga dapat sa patient's skin. Okay, so you have to cover pa that one with a cloth. Okay, so again, for closed wounds, ice application, compress. Why do you need to compress? Compress well, you can use now your bandages. for compression, either this one or your elastic bandage. Why are you going to compress? So that you can limit the inflammatory process. Sa man inflammatory, that's why muhubag yun na siya, kanang tikalpo ka, or kanang masugbagan ka, muhubag siya, or black eye, muhubag, diba? Why? Nga naman, because our body has its own mga soldiers, no? So, part of our white blood cells will go to that area to do phagocytosis. Ang say phagocytosis, iyang panganon ang mga katong mga like mga foreign object, mga like mo start man na siya o maggawas dito ang mga kaning mga sa to kaning itong mga substances of our body, no, that will lead into kanang paghubag. So naatay reaction niya, inflammatory process, so inflame siya, so to kanang mas lower ang inflammatory process, then you do compression and you apply ice, no? So compression, you can use those bandages and you can do splinting. Kaya siya, this is crash injury na ligsan, no? So with that, no, you will bring the victim to the hospital because there could be internal bleeding. There could be damage to vital organs inside, no? Especially kung niagos sa kiyan. Crash injuries, this can also happen. This can also happen when kanang ano bitaw kanang sa tawag ani. Sa madamag bitaw kanang madasok ka sa manibela or kanang ang imong diri bladder mapiit sa ano kanang seatbelt, no, sa seatbelt. So it can also be the reason for your crash injuries. With open wounds, we have different kinds. Puncture wounds. Puncture wounds could be due to gunshot or could be due to kanang dunggab. Abrasion, nagasgas. Laceration, nalaslas. Okay, then you have avulsion, natanggal. Pag, for example, nagpaaks iro, nabira, nakibot ang skin part. That's avulsion. Incision, clean cut. Like for example, with sa surgery. Or kana siya sa picture. What's the difference between laceration and incision? Ang incision is na-slice ba? Na-slice, that's incision. Ang laceration is na-laslas, kanang dili siya clear, dili siya clean nga pagka-laslas, no? Dili siya clean nga pagka-slice. Okay. So, kana, no? Mas klaro. That's stellar, no? And then you have flap, that's avulsion, puncture wound, pinakan, okay? Or natunog stansang, amputation. Okay, so with wounds, open wounds, what will be your main problem? Of course, bleeding, and then you will have a problem of infection. So what will you do? With first aid, always remember to prevent infection. Okay, at to prevent blood loss. So you have to stop bleeding. There are different kinds of taog dagway kay kusog kay dugo. No, actually it could be because the bleeding is due to the kanang damage on the arteries. Arteries mangod ang blood ana is murag spurting yun. Kusog kay pula kaayo, no? Generally more serious because it is deeper. The injury is deeper. The blood is bright red and it is spurting. Why? Gikan man sa atong heart. No, when arteries are bringing the blood from the heart to the vital organs or to the different parts of the body, while venous blood is the blood that is coming from the different parts of the body, and it brings that blood will be going now to the heart for cleansing. No, daton po siya sa lungs para nga ma-oxygenate siya. That's our venous blood. And then capillaries na tunang gagmay kanang namutap kita kay natos naon gagmay kay mga ugat-ugat sa capillary. Okay, so stop bleeding. Mo ginay mo ha kuan. So how are you going to stop bleeding? You can apply pressure. Okay? Kung kusog kayo ang bleeding, dili nimo problema, secondary ra na ang problema nimo sa infection. You can treat infection later. Ang imuha gyud kunahon is stop bleeding. So apply bandages. So when you apply bandage, no? Let's say for example, you apply a bandage here. Okay? You just para ma-prevent the infection, don't touch the area that will be touching the wound, no? So touch the size of only the size of the bandage you have. And then kung masok na siya of blood, you just have to apply another one on top. And then you can now apply compression using either your elastic bandage or your triangular bandage. So apply ka diha og pressure. Okay? para ma-stop ang bleeding. Kung mapuno na siya, don't remove that or else mo fresh na po to siya. Why you should not remove also the bandage that is placed there na soak na blood? Because pagkabot sa hospital, this can be a basis for the fluid replacement, kaya pag blood transfusion. No? So, timbangon siya ang gauze, unsa ka bugat. So, mahibalan sa doctor, unsa ka daghan ang i-transfuse ng blood. Okay? And aside from that, pag putama ko din mo atong bandage diha, nag-start na to siya o kanang ang fibrin, nanay fibrin network. No? Unsay fibrin network? Kanang mo pakugat bitaw. Okay? Muna siya. So, pag remove mo ato, ni fresh na po siya. Okay? So, when you also, o kung gamay na ang samad, prevent infection. Wala kayo siya ga-bleed, no? Pero ang imong problem na po karon is to prevent infection. So, what will you do? You have to cleanse the wound. So, kung nakay fresh, nakay water din ha, it's better to clean it with water, not alcohol, because alcohol is so, kanang has drying effect, no? Then, sakit po na kayo, di ba? So, kung nakay betadine swab, then you can use the betadine swab. If not, then you can apply betadine, itong, before i-cleanse, betadine cleanser. Better siya that, ayaw na to, dili na applicable ang itong hydrogen peroxide, ha? Wala na tagagamit. Instead, we are using the betadine cleansing. We don't use alcohol po, okay? Now, siya drying effect, and then napod siya, sakit po siya. So, better pa na by water or NSS, no? Normal saline solution. Okay, and then when you apply, and then siya, for example, no, when you cleanse, for example, wala ko kadalang betadine, sorry. When you use the gauze sponge to clean, okay, I'm using, it's either you are going to use kanang gloves or you are going to use the forceps, you have to clean. Dali na lang, sa likod lang, for example, no? You have to clean from the middle going out. Okay? Going out. Dili kayo magbalik-balik, okay? Or else, ang imong infection or ang imong kabal, sunod mo sa samad. So, gikan ka sa samad, that is treated cleaner, i-open mo na siya, going out ang imong pag-cleanse. Okay? Going out. And of course, don't just throw this away anywhere because it has blood in it, di ba? So it may lead to infection. Somebody else can contract an illness, or there could be an HIV there. We don't know. So muna. And then we have another, aside from that, we can do, kung katong going back sa bleeding, sige pagyapon siya bleed, then apply pressure on the pressure point. So kung dili siya nasamad, apply pressure here. Okay? Or kung dili siya nasamad, you can apply pressure here. And sa katong mga soldiers, they usually do, they mag-choose na sila. Kung sila lang gusto, life or limb. So, magpili pa. Kung ganahan sila, especially layo pa kaayo ang hospital, no? Ilang nang gi-carry ang victim. So, choose sila og life or limb. So, unsa may buhaton, they will do tourniquet. No? Higdan. Kung diri for example, kanang unsa ni okay ra og naputol yun to, kay butangan naman siya ang bandage, no? Butangan na siya bandage na-amputate, for example. Okay, butangan siya bandage din na-stabilize siya, no? I-anchor na lang na siya. What if naigo og bomba? Hala, sige, buslot naman. Sige, nagtubod ang kuan. So, apply sa pressure diri, digid madala. Ilang butangan diri, digid madala, sige, dugo. So, life or limb, butangan nila ang tourniquet here. So, what will happen kung i-tourniquet? Dili na mo sa dugo, but this part could die. Mag-necrosis. So, pag-abot sa hospital, putnon din siya na area. So, wala sila yung choice kay, or else, mag-blood loss siya, mamatay man nila ang cobra. So, they are going to put tourniquet, they have to choose between life or limb. Okay? Pressure point. That's why you have to be very careful with that. Okay. So, controlling the bleeding is a priority. Okay? So, amputation, crushed wound, open crushed wound. With impaled object, didunggab or natungsok og lapis or what? Don't remove that impaled object or don't remove. What will you do? Stabilize. You can make a donut, no? Para simple ra, naon na nimo. Naon, but there's I'll teach you another way, no? Imo siyang paghimo kag donut ma. Like this. Imo na nagipalingkod din ha. Okay? Tuyok-tuyok ra ba? Tuyok-tuyok. Okay? Okay, you have a donut there. Butang siya. Asa tong So there's an impaled object there, no? Kani for example, na siya dire. Idungga og gunting. Ana, idungga og gunting. Na ang gunting diya. So stabilize as somebody to then pwede po siya rin butangan siya dire o bandage surrounding that area, ang bandage to control bleeding. And this one, you are going to careful not to push this some more. So i-hold lang siya and then you apply now apply the sa tawag ani donut to stabilize, and then of course you will anchor. No, you can use now another bandage to stabilize that. Okay? Rather than removing, so another bandage here para ma-stabilize. Ako lang sa i-demo ha. Later we will ask somebody to be our victim here. Okay, so stabilize. Of course, imo na siya anchor dito. Okay? Anchor siya dito sa likod. No. And then stabilize. Okay? So don't remove that impaled object. Why? If you are going to remove that impaled object, we have two more problems. What? Bleeding and infection. Because you are going now to open the area. So, especially kung chest, you will have a problem of sucking chest wound. No? Ang iyang pressure, negative pressure siya, and ma-change ang pressure dito. So, sucking chest wound. Di ba, breathe out anak mo expand atong chest. Instead, mo expand, ana siya noon, baliktad. Okay, so don't remove. Okay, even sa cheek or sa paa gidungga, no, stabilize lang until you reach the hospital. Okay, at least sa hospital, naan naman tayo mga kahimanan to manage bleeding and other problems. Okay, with eye injury, okay, ana siya. Okay, you can again use this, okay, bandage. Okay, this is very important with akong bandage. Okay, para nga ma-prevent ang eye strain or ma-prevent ang further injury in the eyes. Then kung ay foreign objects as eyes, flush lang, flush with soap. No, flush with water lang, no soap. Flush kayo down more. And then don't try to remove it unless maklaro ni mo, then use the soft cloth or kani naamo ko ni siya fiber. So the more nga kuan siya, mapuling. No, so better flush na yun the water. I have tried that. No, flush na yun na water. Wala pa yun nakuha, and I went to the clinic and I asked the doctor to remove it. No? And then, with black eye, of course, again, you will have your eyes application. Okay, eyes application. Nose injury or kanang nosebleed. No, so apply pressure here on the nose. Dili na to pwede to anahapahayawan. No. Why? It can lead to aspiration. What is an aspiration? Kanang masulod siya sa lungs, no? Ang fluid or ang blood. So apply pressure here, kanang nose bridge nimo, ng area where brag mo, apply pressure there. And then, kuan kan gamay, duko gamay. And you may apply ice here or here ang ice. Or you can sip, you can have kanang ice chips. Okay, and then within like 2 to 3 hours or within 8 hours na kanang resikag nosebleed, ayaw sa ginom og hot drinks. Okay, cold drinks better siya kung cold drinks. Dayon, don't pick your nose and don't blow your nose. Okay? Pero if sige gyapon siya bleed, then go to the hospital so you can have kanang like for example kanang anti-bleeding medication, like for example Mustan, no? So adto na nang hospital dayon. Kung sige gyapon siya bleed, even if inom na ka og kanang bug ng tubig, na apply na kag ice, and then if you pinch the nose already. Okay? Chest injury. So as I mentioned kanina, you have to prevent, no, kanang going into shock. So usually sa chest injury, ang affected atong breathing. So assess PVC again, airway, breathing, circulation, and prevent shock. And you position the victim to the position na sayon siya makaginhawa. Okay? Neck and spinal injuries. Okay. With that, we will be applying the bandaging and splinting. Okay? You have to immobilize, no, that part, because if the asya is spinal or spinal injury or neck injury and you suddenly move the victim without considering kanang damage, then it may lead to death or eventual coma. Okay. So, with the muscle strain, or strain and, what's the difference sa strain and sprain? Strain sa muscles, sprain sa ligaments. Ang ligaments is katong between the two bones. Yeah. Okay. So, strain and sprain. And yeah, just remember the acronym PRICE. So PRICE, P-R-I-C-E. Okay, what is that? Protect the injured limbs from further injury by not using the joint. R, rest that injured limb. I, apply ice. C, compress using the elastic wrap or bandage, elastic bandage or triangular bandage. And E, elevate. Okay? So, PRICE. The same po siya sa dislocation. No? Yan na. So, kung sa to siya sa sprain and strain. No? PRICE. Okay. Or we can have even the prices. Lastly is the splinting. We can apply splint. Okay. For dislocation, the same. Now, for fracture, we have different kinds of fracture again. No? Closed fracture, open fracture, we have green stick katong brag na kuan dito kanang ni ana ra gamay no, brag crack no, and then we have the comminuted katong ni splinter yun ang bones dito sa sulod, and then we have the diagonal fracture, we have the longitudinal fracture, ana no. So we have different kinds of fracture. So with the fracture, ang ato ang yung goal is prevent that closed fracture to become an open fracture. So what will you do? You have first and foremost immobilize that area so that dili ma-damage ang mga nerves and dili po siya makasamad sa mga ugat. Or else, with a closed fracture, imo ni unnecessarily move, nasamad siya, nag-open fracture siya, daghan ang problema, bleeding, infection, and so on. Okay? So, signs and symptoms of fracture, broken bones, pain, deformity, swelling, tenderness, shock, and lack of feeling, numb, or tingling sensation below that fracture area. Okay, so what would be your first aid for fracture? Check the ABC again, keep the victim still or immobilize the victim, prevent infection by covering the area with sterile dressing before immobilizing, kung open fracture. No, and then split or sling the injury in the position which you found it, take steps to prevent shock, and of course get medical help. Okay, for fracture, acronym would be RICES. R, let the victim rest. I, apply ice. Okay, when you apply ice, it would be 30 minutes, apply ice, then 30 minutes rest, and then apply 20 to 30 minutes every 2 to 3 hours for the first 24 to 48 hours. Okay, same with kung masamad ka or mabunol ka. First 24 to 48 hours, apply sa ice. Pero after 48 hours kung mabunol, after 48 hours, apply na kaog, init-init. But with your fracture, apply ice for within 24 to 48 hours. C, compression, E, elevate, and S, splitting. Okay, so we are done with the basic, first aid, no? The theory part. Okay? So we will be discussing. Next would be the demo on how we are going to do splinting, bandaging, and lifts and carries, or transporting the victim. Okay, thank you for listening.